So hello and welcome. Thank you for joining us for our second Brain Matters webinar for the fall on cognitive impairment and the role of blood pressure. So my name is Jessica Lawson. I'm a public educator with the Alzheimer's Society Southwest Partners. I will be the MC and moderator for today's webinar. My colleagues Susan Oster and Ashlyn Humphrey are on the back end of things. So they will be helping me with the technical support for today. They are also public education coordinators with the Society. So at the Alzheimer's Society, our role is not only to provide programs and services to people who are going through the journey of dementia, but also to provide dementia education and to advocate for those who are living with cognitive impairments. So before we begin, I have a little business to go over relating to the webinar experience, just some technical features. So please note that all of your cameras are turned off at this time, and your microphones are also muted for the webinar. This event is being recorded and will be available in the future on our YouTube page. At the end of the presentation, we will have approximately 15 to 20 minutes for a moderated question and answer session. We will do our best to get through as many questions as we can in that time. During the presentation, if you think of any questions for the panelists, please add them to the Q&A box located at the bottom of your screen, as you can see on this slide I'm sharing with you. If you would like to submit a question anonymously, please click the Send Anonymously box before clicking the Send button. So just another feature, we also have enabled the upvote feature in Zoom, which allows people to see all questions being asked and to move the most popular questions to the top of the list. So if you see a similar question posted by someone else, you can simply upvote on the question by clicking the thumbs up icon underneath the question as seen here. So once the icon is clicked, the question will move up in the list. And at any time, should you have any technical concerns, please type in the chat box, and both Susan and Ashlyn will be happy to help you. You may need to move your cursor around to see the Zoom controls and icons, but you can submit your technical concerns in the chat box, and they will be only seen by the panelists, which includes myself, Susan, and Ashlyn. So since everyone's situation is unique, the information being provided in this presentation is for educational purposes only. Should you have specific questions for your situation, please contact your social worker. Now I have the pleasure of welcoming our panelists. So Dr. Jaspreet Bangu is a geriatrician and assistant professor at St. Joseph's Hospital and Western University. He graduated from the Royal College of Surgeons, Dublin in 2004. He completed his specialist training in internal and geriatric medicine in Ireland in 2016. He completed a PhD in medical gerontology with Trinity College Dublin in 2017, studying falls in older adults. Dr. Laura Fitzgibbon Collins completed her PhD at the University of Waterloo in brain blood flow and mobility, and she is currently a postdoctoral associate at Western University and Parkwood Institute. Her research focuses on how brain blood flow affects walking, balance, falls, and cognition. She studies how and why accelerated changes of the arteries impact brain blood flow and the brain's ability to function. And last but not least, Dr. Jeff Coombs, a Faculty of Health Science PhD at Western University. He studies the changes to cerebrovascular structure and function that occur with aging and how these factors contribute to cognitive decline. Additionally, he is interested in how lifestyle factors such as physical activity and fitness can improve brain health. And with that, I'm going to turn it over to the panelists.
Okay, thank you for that introduction, I think the plan is for me to start with my portion of the presentation. So I will share my screen here. Okay, can someone confirm they can see my slides?
Yes.
Perfect, thank you. Okay, so we'll just start with a land acknowledgement to recognize the traditional territories that Western University is located upon and where the majority of our research has been performed. So I'm going to start talking about blood pressure in general, and this might be a bit of a review for some people, but just to make sure we're all on the same page, and then I'll move along and get into how blood pressure, specifically higher blood pressure, can affect the brain. So one way that you can monitor blood pressure easily and at home is using just an automated cuff that looks like this. And you can have the cuff around your arm, press start, and basically the entire process is automated. And you'll get some numbers that you see here, and you'll have the upper number, which is a systolic value. This is the blood pressure that is being measured while your heart is contracting. And the lower number here is diastolic blood pressure, and that's the pressure in the heart as it's relaxing and filling up with blood again. And some, but not all, blood pressure monitors will also give you a number at the bottom that might indicate the pulse or your heart rate. Okay, and just to note quickly, the heart rate could give some information about potential heart issues, but there's a wide range. So anywhere generally between 60 to 100 beats per minute would be something that's a normal pulse. I'll get into normal values for blood pressure in a minute, but just to note, it's really important to make consistent measurements and to do proper measurements. So always make sure you're seated in a chair with your back supported, rest your arm on a table or something next to you, you have your feet flat on the ground, you're not crossing your legs. And I think one of the most important parts is to make sure that you're relaxed. So don't come home from a 20-minute walk and immediately measure your blood pressure, right? If you want to get an idea of what your typical blood pressure values are, try to make sure you've been sitting around quietly, relaxed for at least 5 to 10 minutes before you go ahead and take that blood pressure measurement. And ideally, if you can do this on a daily basis at a very consistent time. So for example, maybe you want to wake up in the morning when you're relaxed, you haven't done much activity yet, and kind of measure your blood pressure at the same time every day. That'll give you a good idea about potential changes that are occurring with your blood pressure. So here we have blood pressure guidelines from Hypertension Canada. There's a lot of numbers on here, but if you just focus on the right part of this table here, we can see what the blood pressure treatment targets are. So what we want to aim to get your blood pressure to. And this depends on risk factors and other diagnoses such as diabetes, but in general, I would say we would like to have blood pressure as close to 120 or 130 over 80 as possible. So these are kind of the lower end of the targets that we would be aiming for, and these targets might be slightly higher if you have additional risk factors. Okay, so what is isolated systolic hypertension and why does it happen? So basically, this is the most common form of hypertension, and age is the largest risk factor for this condition of hypertension. So basically what we get is, if we look on this graph, we have blood pressure here on this side, and on the bottom we have age. So not surprisingly, as we age, we get increases in blood pressure, but this affects the systolic and diastolic portions of blood pressure differently. So you can see that systolic value in the top line here, that would be your 120 value or the upper number. It kind of increases linearly and progressively with age. And when we compare that to the diastolic or the bottom portion of your blood pressure number, we get some small increases with early aging, but then it tends to flatten out. And what that means then is that we have this increased pulse pressure. And just to show a different example of that, if we have a typical or textbook example of 120 over 80, the difference between those values is 40, right? And we call that our pulse pressure. So it's the difference between systolic and diastolic. And as we age, these numbers might become something more like 140 over 80. Okay, this is a typical example of someone with that isolated systolic hypertension. And now that difference between these values, or the pulse pressure, is greater, right? It becomes 60 instead of 40. And that's really important because this high pulse pressure is particularly dangerous for the brain. And I'll get into how this process occurs and why it's bad for the brain now. And essentially, we can think of our blood vessels or arteries as a garden hose, and they're supplying blood or the water towards the brain. Okay, so this might be our carotid artery in the neck leading towards the brain. And if you think about whenever you've used a garden hose out in the yard, if you apply some pressure to that hose, or you increase the resistance, you'll know that that causes the outflow of water to become much faster and much higher pressure, right? So in this example, adding that resistance with your finger is the analogy of a stiffer artery. So as you age, our arteries become stiffer and they add resistance, and that causes the flow of the blood to become higher pressure and faster. What we really want, though, is to have compliant arteries, okay? And so if we have a compliant artery, that will decrease the pressure within the hose, and it will allow us to just have this kind of gentle, continuous flow of blood or water in order to supply nutrients to the brain, okay? So instead of that stiff artery with high pressure coming out and kind of blasting the brain with high pressure, we just want a gentle, continuous supply of blood in order to make sure the brain gets what it needs. And to kind of highlight that in a different way, I'm going to hope this video works. This is kind of a lab example. So we're going to start with what would be a stiff artery. And this is to mimic the function of a heart where it's pumping intermittently. And if this hose here is an example of a stiff artery, you can see how fast the flow is coming out. And also notice that when the heart's not beating, there's a lack of blood flow in between beats. So if we skip ahead and compare that to an artery that's more compliant, we'll see what happens in just a second. So now we have this section of the artery that's more compliant, which means it expands with the extra blood flow. And you can see how much lower pressure the flow is into this bucket here. And not only is the pressure of the outflow lower, but it's actually more consistent. So even when the heart's not beating, you still have some continuous flow occurring. So I hope that that video was visible to everyone, but essentially the point there is that we want to have continuous but low pressure blood flowing towards the brain so we have constant delivery of nutrients. And when our vessels become stiffer as we age, that actually changes the flow of blood from low pressure, constant flow to really high pressure and more of an intermittent flow. So it doesn't have the same constant delivery of nutrients that we would hope to have. Okay, so why is that blood pressure that's directed towards the brain so important? We take a look at this graph here. Basically, the y-axis represents the risk of developing Alzheimer's disease, and on the bottom we have the systolic blood pressure. So one thing you'll notice is that above 140 millimeters systolic blood pressure, you'll see that any increases in blood pressure increase the risk of developing Alzheimer's disease. What's probably very evident on this figure as well is that you also have a large increase in the risk of Alzheimer's disease with lower blood pressure in this case. And that's something that Laura will speak to in her portion of the talk. We also can identify the risk of vascular dementia depending on blood pressure with this graph here. So higher on the y-axis represents a greater risk of developing dementia. And you can see that above, again, that reference value, about 140, we have pretty large increases in the risk of developing vascular dementia as blood pressure increases. And I think it's important to note as well that one of the hallmarks of Alzheimer's disease is this amyloid beta protein accumulation in the brain. And this accumulation is also linked to higher blood pressure values. So as blood pressure increases, we're getting more of this kind of hallmark pathology of Alzheimer's disease. And so what that means is that even though we have two different types of dementia here, Alzheimer's, which is the most common, and vascular dementia, which is the second most common form of dementia, they're interrelated. So in fact, many dementias have some component of both of these types of dementia, and the blood pressure can accelerate the risk of developing Alzheimer's disease as well. And so to add a little bit of context about the vascular dementia, basically what that means is that you can develop this small vessel disease in the brain that leads to cognitive impairment over time. So this is something that happens starting in midlife, and you don't notice it until it's already developed. So if we take a look at some examples of brain imaging with MRI, you can see in midlife, the brain looks pretty normal. You might have some mild small vessel disease. The small vessel disease is these little kind of areas of damage to the very small blood vessels in the deepest part of the brain. So they show up as these little regions on the MRI scans. And again, they develop slowly and over time, and they're related to lifestyle factors such as blood pressure, physical inactivity, age. And over time, as this disease progresses, it might manifest as cognitive impairment. And so here we have an example. This is a pretty busy slide, but this is an example of some of the type of research that we're currently working on. So we're trying to really hone in on the mechanisms of small vessel disease related to blood pressure. Okay, so we can use, these are examples of MRI images that we can take, and we can use that to measure blood flow inside the brain, which is normally very difficult to do, right, because of the skull and the kind of inaccessibility of the brain. But with new technology, we can get these really nice images of the blood vessels in the brain. We can measure blood flow. And essentially what we're trying to do is we can map out blood flow similar to a blood pressure waveform. So when I talked about that pulse pressure before, the difference between the upper and the lower units, we can do the same thing with flow. So we can get a measure of the pulse style flow from the upper and the lower value. And essentially if that value is really high, it's probably due to really high blood pressure being sent towards the brain, which might be related to the development of small vessel disease. And so lastly, I want to touch on some of the lifestyle factors that we discussed, mainly fitness and exercise. So I'm going to talk about this in context of compliance or that stiffness of the blood vessels. So remember, if you have more compliant vessels, that's going to lead to a lower blood pressure. And what we can see from this study on the left, when we compared younger individuals to middle-aged and older, you can see there's a drastic reduction in the compliance of their blood vessels. So they've become a lot stiffer with age, and that's contributing to high blood pressure. However, these are sedentary individuals. So if we look at an example of younger compared to middle-aged and older adults who are now endurance trained, people who are very physically active, we can kind of offset some of those aging related factors that contribute to blood vessel stiffness. All right, so it seems like being more physically active and having a higher level of fitness is able to prevent some of these age-related declines in vascular stiffness. But it's never too late. So if we take a look at this study on the right, this was an 8-week training study, and they measured arterial compliance, and they found that people were still able to increase their arterial compliance, despite their age or previous physical activity levels. Okay, so there's always time. We can always take up physical activity, exercise, and the change from being sedentary to doing some level of physical activity always carries the greatest reduction in risk factors. All right, so the main takeaway there is to get active and try to be consistent. Even if it feels like it's a small amount, it's always helpful. Okay, so that is it for my portion of the talk. I will pass things along to Laura, and hopefully she'll follow up on some of these ideas.
Okay, thank you, Jeff. Can everybody see my screen?
Yeah.
Yeah, okay,
Yep.
Great. Okay, so Dr. Combs identified how high blood pressure can impact our blood vessels and impact dementia. I'm going to talk a little bit more about low blood pressure and brain blood flow, and I'm also going to touch on some physical activity and how this relates to cognition. Okay, so here were some of the blood pressure targets, identifying what high blood pressure is and when we intervene with blood pressure treatments. And what I also want to point out is that there's been a study on 4.5 million people, and they identified that also there are risk levels for having low blood pressure. So what they've identified is that there were 2 categories, one with low blood pressure of having a systolic blood pressure between 100 and 120 millimeters of mercury that were associated with the development of overall risk of dementia, and also individuals who had a very low blood pressure of a systolic pressure less than 100 millimeters of mercury or less than 60 millimeters of mercury also had associated risks with both overall dementia and higher risk of probable dementia with Alzheimer's disease. And this is, again, that same graph that Dr. Combs had pulled up, where the increased risk of developing Alzheimer's disease was associated with having low blood pressures in addition to high blood pressures. So here we have that reference point. And if we look at blood pressures between, let's say, 110 to 90, you can see how high that risk increases. And so why is it that we have this relationship? Well, when we have vascular dysfunction, or what we term vascular dysfunction being having poor regulation of blood pressure in the arteries, we get this disrupted flow. And as a result, we'll end up with sometimes high blood pressure and sometimes low blood pressure. And as Dr. Combs outlined, the high blood pressure does lead to damage of the brain tissue. But also when we have low blood pressure, we have a reduction of nutrient delivery and a reduction of oxygen delivery. But as well, we have which leads to brain tissue being damaged. But we also have a reduction of clearance. And so reduced clearance of amyloid beta proteins is a hallmark of having Alzheimer's disease. And so when the brain tissue is damaged, it impacts our ability to think. And so this is how both low and high blood pressures can impact our ability to think. So we've talked a little bit about lying down and some of the imaging studies and how brain blood flow works. And most of the work has been done in the lying down position. And this is when the heart and brain are on the same horizontal plane. So this would be with an MRI or a PET scan. And as Dr. Combs described, it adds a lot of very valuable, detailed information about how the blood is traveling to different regions and how the brain is acquiring those different resources. However, what's also important to consider is what happens to brain blood flow when we're in the upright position. So when we're standing up, such as during walking or cycling or anything in the upright position, the cardiovascular system is required to deliver adequate blood flow to not only the working muscles to perform the task, but also to pump blood against gravity up to reach the brain. And so I'm going to show you what happens to both blood pressure and brain blood flow when we go from lying down to standing up. So in the blue tracing here, we have blood pressure, and in the gray dash tracing, we have cerebral blood flow velocity. And on the x-axis, we have time here. So the negative time is when they are lying down, and then the positive time is when this person is standing up. And as you can see, as they go from lying down to standing up, we get this transient drop. And this drop typically recovers within 30 seconds. However, in some individuals, it doesn't. And I'm going to get into that in the next couple of slides. So if you've ever gone from lying down to standing up or squatting to quickly standing up, you may have felt lightheaded or dizzy. And so in some of the research that we've done in the past couple of years, we've looked at how brain oxygenation changes when going from lying down to standing up. And is it related to balance or stability? And so what we found were that individuals with high brain oxygenation, as you can see in the closed circles, they also had better postural stability or better balance. So this is like a bird's eye view of their sway. When they stood up, you can see that the person with high brain oxygenation had a tighter, less sway movement when standing up compared to the individual who had low brain oxygenation. They had a very large drop in it, and it was lower when they were lying down and again when they were standing, and they had a much larger sway pattern. And we know that these sway patterns are related to risk of having a future fall. And so it's been reported that not only 20% of older adults in the aging population have a pronounced drop in blood pressure and poor recovery of blood pressure when they get up, but also 20% of older adults demonstrate a large enough reduction in brain oxygenation when getting up, which is also related to instability. So what we're starting to look at now is if we know there are reductions in brain oxygenation when getting up from lying down, how does the brain blood flow respond when getting up to go walking? Because that's a task that we do quite often. And not only how does that brain blood flow change when we're walking, but also how is that related to cognition? So what we're doing now is we're looking at, as you can see here, we're looking at brain blood flow on the y-axis, and we have again time on the x-axis, and we have someone who's been sitting right here, and then they are walking for 1.5 minutes or 90 seconds. And we have two individuals depicted here. We have one individual who had high brain blood flow from sitting to walking, and we also had one individual who was unable to increase brain blood flow from sitting to walking. And what we're starting to see is that for this individual with higher brain blood flow during activity, that they also had a higher score on all of their thinking ability tests, and they also walked faster compared to the individual who was unable to increase brain blood flow when they were walking. They had a lower score on their thinking ability tests, and they walked slower. And so when we're moving forward with this research, we're not only looking at how does the cardiovascular system and all of the brain blood vessels respond to physical activity, but also how does that relate to our thinking abilities. And we're also hoping to look more into sex differences between males and females. And if there are any other underrepresented groups, how is this different in different populations within our society? A few things that we do know about brain blood flow and physical activity is that regular exercise has a positive effect on vascular function, or the ability of our blood vessels to increase brain blood flow. And that exercise has been shown to protect against cognitive decline. And also regular exercise has been shown to improve cognitive function. So what does this mean? Well, aging is inevitable. And what we need to start doing is foster a positive perspective on aging and really place a lens on healthy aging to help us reduce our risk of developing dementia or preventing the progression of dementia. And so in placing a lens on healthy aging, I wanted to provide you with some of the guidelines by the Canadian Society for Exercise Physiology. And these guidelines are denoted as a 24-hour movement guideline, and it includes physical activity, sleep, and sedentary behavior. So for physical activity, it's recommended that older adults who are 65 years and older engage in 150 minutes or more of vigorous to moderate aerobic activity. And they identify this as being having a large variety of activities. So balance challenges, muscle strengthening, to incorporate as many different types of activity as you can. As well, they have identified that there should be several hours of light physical activity. So this could include going for a walk or gardening, but that there should be a large volume of activity in the day that is very light. They've also identified that good quality sleep. So it's not just the duration, but to have good quality sleep. So regular sleep and wake times, as well as reducing sedentary behavior. So limiting sedentary behavior time to 8 hours or less. This means that there should be less than 3 hours of recreational screen time, and also break up those long periods of sitting as much as possible. And so in keeping this 24-hour movement guideline into perspective, it's again trying to increase our amount of moderate to vigorous physical activity, also to have an even larger amount of light activity, to have a long duration of good quality sleep, and to minimize our sedentary behavior as much as possible. And so I'll leave this now to Dr. Bangu.
Good afternoon, everybody. Thanks very much for that, Dr. Fitzgibbon-Collins and Dr. Coombs. So Dr. Bangu is my name. I'm going to try and take you through the last part of this, which will focus a little bit more on, okay, so we know that both high blood pressure and low blood pressure can be dangerous for our brain function. What can we do about it? First off, I just want to mention some disclosures that I'm a principal investigator and currently involved in research that's sponsored by pharmaceutical companies. So these are the pharmaceutical companies that I'm currently providing research with or performing research with. And also, as Dr. Coombs had done, we want to make sure that we have a land acknowledgement for Western University where the majority of this research is taking place. So if we look at things in a larger context, we've just talked, what you heard a lot from Dr. Coombs and Dr. Fitzgibbon-Collins is about how important exercise is. And it is so important. And what we're realizing is that what used to be is what is quite common actually still in the healthcare system is that we take patient A and we say, okay, I'm going to treat disease X. And if I treat disease X, you'll get all of a sudden better. What we realized is when it came to the brain, there was just too much that went in that influences the brain, that only treating one disease or only focusing on one thing wasn't going to cut the mustard. So what we started to talk about is multi-component interventions. And this is where we look at an entire lifestyle rather than just one specific disease or one specific risk factor. And we try and incorporate an entire lifestyle change into older adults' lives, especially those with cognitive impairment. So the good news is that there's multiple clinical trials now that have shown that if we actually focus on this in a multi-component way, it actually works. We've seen, there's one study in particular called the FINGER trial, which has been a very famous study that's been quoted many times. And it's shown improvements in multiple cognitive domains. So not just in memory, but also in working memory, executive functioning. In other words, the ability to do mathematics, to learn new things. And you also get improvements in mood and in chronic illness. A large part of this was due to the improvements in vascular risk reduction, which you can see over here, vascular metabolic monitoring. And vascular risk reduction really principally is driven by how much we can control blood pressure. And as you can see now, the finger trials had been so successful, the Alzheimer's Association has started a worldwide fingers, which is basically trying to incorporate these multi-component interventions into our teaching, into our literature, into the everyday lives of older adults, especially those who have any type of cognitive impairment. And the map on the right shows just how many countries are involved so far. Obviously, we need a lot more involvement from lower economically developed countries. But certainly in Canada, the US, and other Western countries, there's been a large adoption of these kind of interventions. So before, where we used to study single interventions, where we would only say, look at, okay, well, let's change blood pressure and see what happens. Now we say, well, let's change blood pressure and let's also change nutrition. And let's also improve exercise, and let's improve sleep, as many of them as we can in the right population. Study that population for a long period of time, and let's see what benefits what, so that I can, maybe come back in 5 years from now and say, okay, well, if Miss X is able to do 30 minutes of exercise, her blood pressure will come down by this much. And if she's able to incorporate some nutrition with that, we know that her brain function will improve by that much. And that's really where we want to go to now when we're treating any kind of cognitive impairment. In terms of nutrition, it's really important that we stay away from fad diets. So a lot of the questions I get asked in my clinic relate to what are the types of nutritions, what are the types of diets that we should be using. And really, there's two main ones that I would recommend. So, you have to be very careful with diets, because obviously there's a lot of money to be made in the diet industry. So there's two that are recommended and adopted by most associations, and that I can recommend as healthy for older adults, because they've been studied and have shown to benefit brain health. The two of them, one of them is called DASH, which is a dietary approach to stop hypertension. And the other one is the Mediterranean diet. And I don't know if people have heard of these types. Really, they are very similar. To be honest, there's very little difference between them. And what they actually emphasize, without going into this too much, is they emphasize a diet that's based mainly around fresh fruits and vegetables, whole grains, things like legumes. And so you start your diet around that. So if you were going to the grocery store, you're going to Loblaws or No Frills or wherever it is you shop, the first aisle you go to is the vegetable aisle. And you say, well, Monday we're going to have this vegetable. And then you start to think of, well, what's the next thing to cook with that? Are we going to have a little bit of fish and seafood? Are we then going to, the next line is poultry, things like eggs and cheese and yogurt. And lastly, you would go with things like red meats. And that's not to say you have to cut out red meat altogether, or that all red meat is bad, et cetera, et cetera. That's not it at all. It's just trying to change the way that we consume and that we shop, in that we would place vegetables and fruit at the top of our pyramid, and at the very bottom we would put things like red meats and anything that are sweet. The next major intervention is around alcohol and smoking. And some of you may have heard about the new Canadian alcohol guidelines. They've been released very recently to some controversy. I think the important thing is to talk about risk when you're talking about alcohol. And really, a lot of the risk is that we know with alcohol isn't just liver disease. In older age, it is actually to do with brain function and with blood pressure, because we know that alcohol can affect that what Dr. Coombs was talking about and Dr. Fitzgibbon-Collins, which was to do with the arterial stiffness. We know that alcohol can either increase or can increase our arterial stiffness and adversely affect our blood pressure. So the new Canadian guidelines are especially important for older adults who are living with any type of cognitive impairment. And this is where you start to think of how many drinks can I have before my risk of adverse outcomes? And by that I mean, what are the side effects that alcohol are going to give me? And usually when we talk about side effects of alcohol, we talk about, you know, getting drunk or maybe having a hangover. We're talking about the health side effects here specifically. And you know, if you really want to have a negligible or low risk, you're talking about 2 standard drinks or less per week. A moderate risk is 3 to 6 drinks per week, and a high risk is more than 6 drinks per week. So what we're talking about is that there is a higher risk of adverse outcomes or of health side effects from alcohol the more drinks that you have per week, the more alcohol that you consume per week. So the take-home message is always try and get yourself into the negligible or low, whilst, you know, still being able to enjoy a little bit of alcohol. If I was to choose a type of alcohol, it would probably be red wine. It does have, I would call it conflicting evidence, but there is some evidence that red wine itself is, of all the alcohol family, has the most benefit towards brain function. That I always warn patients, that doesn't mean you should go out and buy, you know, 10 bottles of red wine tomorrow. It means that red wine taken in moderation and trying to follow the Canadian guidelines will be the type of alcohol beverage that we can recommend. And you know, with smoking, I don't think I'm really saying something that most people here don't know, is that smoking is always associated with worse health outcomes. There's not a single association with a good health outcome. So if we could combine these types of interventions, diet, and you know, lowering our alcohol intake, with other interventions such as social interaction, engagement, brain training, and cognitive stimulation, good sleep hygiene, as Dr. Fitzgibbon-Collins had talked about, making sure that we get hearing aids, which a lot of people underestimate how much that can actually improve our brain function. And of course, as both Dr. Coombs and Dr. Fitzgibbon-Collins talked about, staying physically active. This is what we're talking about here when we talk about these multimodal. We're not talking about just saying, your blood pressure is too high, I'm going to give you a drug, go home, take the drug, everything will be fine. We're talking about, well, if blood pressure is high, that means that we need to do a number of things all at once, as much as we can, in order to get your blood pressure lower. The last part of it is medications, because the medications have side effects, and we don't like putting people on medications if we can avoid it. And I'm sure most of the people who are on this don't want to be on medications if they can avoid it. So what about when we have to treat? So if you've been able to incorporate some of these lifestyle changes, and it's not always easy, I don't underestimate how difficult that can be, but it's very important that we know that a lot of this can be treated with lifestyle. If we can't though, and we see a sustained blood pressure over 140/90 or 135/85 if you have a higher risk like diabetes, well, we will start to treat then. That's when we're going to suggest treatments. And the question always is, how low do we go? And there's more increasing evidence. There's a very famous trial called the Sprint Mind trial, which came out in 2019, and that looked at intensive blood pressure control. So in other words, they tried to get everybody who was in that trial, and these were mostly older adults, they tried to get them down to 120/80, and lo and behold, those who achieved a lower blood pressure also achieved better cognitive scores. In other words, they did better on any memory testing. The problem with all of this is it's difficult to achieve and to monitor. So 120/80 is what I like to call Goldilocks, because you don't want to go it's just right. You don't want to go too low. You don't want to go too high, because too low and too high are both associated with worsening outcomes. So how do we monitor this? And I'll go through that in a quick second. But really, we want to get it. What I say to most patients is we want to get you as close to 120/80 as we possibly can, without causing any side effects. And that's, you know, not always that easy. So the other part about this is that the trials didn't include many older or frail patients, and that's a problem. We don't really know optimal blood pressures for a lot of the people who are on the calls today. So a lot of this is based on people who are probably more what we call robust, maybe a little bit healthier, probably a little bit more mobile, and their blood pressures can probably withstand a lower level. We don't know if older, frailer patients maybe need a higher blood pressure, and that's still something that we're studying. I know, and like I said, it may result in overtreatment. So we always have to watch out for the symptoms of low blood pressure that Dr. Fitzgibbons-Collins talked about, things like dizziness and unsteadiness. One of the things that's a big problem, and I'm sure this will come up in the chat, is things like white coat hypertension, or how do we monitor this? And there's two ways to do that. One is getting a 24-hour ambulatory blood pressure monitoring. This is something your family doctor usually has to order, or you can try and go to Life Labs. Unfortunately, it's very difficult to obtain this via OHIP, so you often have to pay for this yourself. It's the cost, I believe, is $45 to $50 if you get it through Life Labs. But it does give you a really good average reading over 24 hours. It's not always the most comfortable because you're talking about a blood pressure cuff inflating even while you're sleeping. So, you know, it can lead to a much poorer night's sleep. However, if you are able to obtain this, it may help you, may help your physician and you or your caregiver to look for whether or not you have evidence of white coat hypertension, which is to say, every time you go and see your healthcare provider, your blood pressure goes up just because you're anxious having seen your healthcare provider. Another way that's more convenient is home blood pressure monitoring. This I find is much more convenient for most patients. It's cheaper, and the good news is Hypertension Canada have released new guidelines, new ways to actually monitor or incorporate home blood pressure monitoring into how we treat blood pressure. Well, the general rule is you take the blood pressure twice, 2 times in the morning, 2 times in the evening, usually at the same time of day. And I'll show you what that means. You also need to make sure your machine is the right one and is calibrated. So this is an example. And again, this is available on the hypertension.ca, and I'll show you that website in a few minutes. But what this looks like is somebody who I would ask to monitor their blood pressure for a week would take a reading in the morning at the same time, and they take 2 readings. So they'd inflate the cuff, let it go down, they re-inflate the cuff, let it go down. And that's your readings in the morning. So blood pressure reading 1, blood pressure reading 2, and you do the same thing in the evening. You do 2 readings. You do that over 1 week, and then we're able to average that out and actually really see what your blood pressure averages on a week. And that's a much more accurate way and a much more convenient way than just waiting to go and see your doctor in order to monitor your own blood pressure. For any of you who are thinking of buying blood pressure cuffs for home, I do recommend them. And Hypertension Canada have very helpfully on their website published ones that are recommended, that have a gold seal or a silver seal, because they are the ones who are more likely to provide accurate and long-lasting blood pressure measurements. So I recommend that anybody goes on, and if you're going to buy one that's recommended. I only briefly want to touch on the drugs we use. We use about 4 major classes of drugs. Some of you might be familiar with this. I'm not going to go into them in too much detail. I just want you to be, just to know if you've been told by a family physician or by any physician that you're on an ACE inhibitor or an angiotensin receptor blocker. They're usually called an ACE or an ARB, or diuretics, beta blockers, or calcium channel blockers. These are the broad classes of drugs that we often use. There's only 4 major ones that we commonly use in Canada. And what you might see is that your physician wants to only put you on one type of drug at a time, try and bump up the dosage. Sometimes we have to use 2. If you're ever going to be on one of these, make sure you consult with your healthcare provider before you change any of your medications, because it's very dangerous to try and manage this on your own without a healthcare provider helping you. In terms of low blood pressure, some of the things we recommend are these things called physical countermaneuvers, and you'll see some pictures of it here. So if you feel like your blood pressure is lower, you get symptoms of low blood pressure, we do recommend you do things like you cross your legs, or you pump your feet or your ankles back and forth to try and get the blood pumping back from the feet, where blood tends to pool back up to the heart. And that can really help to try and get your blood pressure back up. Some people, we say you should wear some tight support stockings. That helps to mimic that. We always recommend a good amount of water intake. There has been some evidence that if you raise the head of your bed, or if you're able to sleep with 2 pillows underneath your head, that can actually help with symptoms of low blood pressure. And in more severe cases, we use things called abdominal binders, which are really just tight corsets. And sometimes we have to even use drugs, which are available. Again, consult your health practitioner. If you feel like you get quite significant symptoms of low blood pressure, please consult your health practitioners. We can always help with that and try and give you the best type of management treatment that works for you. So I want to try and end it here now and try and talk about some of the take-home messages. So both high and low blood pressure can affect memory and gait. Learning the right way to measure and monitor blood pressure is really important. It's not trivial. And, you know, I recommend that, again, you go to these 2 websites, hypertension.ca or heartandstroke.ca, which are both great websites that tell you exactly what we've been talking about here and give you some take-home messages. And what's really important to think about is treatment is more than just about drugs. We're talking about a lifestyle approach to reducing blood pressure and therefore improving the health of our arteries and lastly improving our brain function. So I'm going to stop it there and we'll take any questions. And I want to thank everybody. I really want to thank the Alzheimer's Society for giving us this platform. And I want to thank everybody who joined in with us today. It's really great to be able to talk and to be able to deliver these messages.
Mute. Thank you so much, Jeff, Laura, and Jaspreet for sharing your experiences and reflections. I sure learned a lot today. So to our attendees who are still on with us, we have about 10 to 15 minutes left for a question and answer session. So I'm sure you have thought of some great questions. I already see some in the Q&A box. I'll do my best to get through all of them. But just a friendly reminder that it does exist, it is there, so post your questions if you have questions. So I will start with our first question. And it refers to a hot tub and the effects of high pressure. So the question is posed, does a whirlpool with high pressure increase arterial compliance?
I can probably take this one.
Okay.
Yeah, I'm glad you asked. My PhD thesis was on heat stress and vascular function, so hopefully I have an answer. I would say probably all of our answers are going to be qualified with it depends, but I'm going to say yes for this question. Heat stress can increase compliance, decrease blood pressure, improve vascular function. We're getting some pretty strong evidence about that, but it's still kind of an early field of research. So we don't have very good guidelines on how often this should be done or how hot exactly things should be, but it's probably more the heat. If you're using a hot tub for 20 to 30 minutes, you know, a few times a week, it's probably more the heat, not the pressure from the jets. But the heat can improve your circulation. It causes blood flow to increase. And actually, when you increase your core temperature a little bit, that kind of promotes some molecular factors that can also benefit vascular function. So yes, you can get some benefits to the stiffness of your vessels and blood pressure from something like a hot tub or a sauna. But I think also keep in mind that it can cause some low blood pressure, right? So your vessels dilate, and then when you go to stand up to get out of the hot tub, your blood pressure can drop very quickly. So you just need to be careful about how hot you get and things like that.
Thank you, Jeff. So our next question is surrounding MRI and CT. So why does it take longer to get an MRI? Does the MRI show more and provide more beneficial information than a CT scan? And if you have a CT scan, can you still have an MRI done?
I'll probably take that one. So the short answer to your question is MRI is just much more expensive, and it's the machines themselves are much more difficult to obtain and much more expensive to run. So through for a whole host of reasons, it really comes down to cost. And actually where you can place an MRI, because the magnets are so strong on some of the more modern MRIs, you can't just put an MRI anywhere. You have to have a very specialized room, etc., that is able to take a magnet that large. So that's the first answer, is that's why they take so much longer, is because we have so many fewer of them as compared to a CAT scan, which you can put nearly anywhere, and it'll be useful. You can, the end of that is that you can get an MRI scan if you have a CT scan. There's absolutely no reason why you couldn't. And was there another part to that question? I think I'm missing a little part to that.
Nope, you got them all. Thank
Perfect.
you.
Yeah.
So this next one speaks to our treatment options, and they're interested to know more about fingers, what that stands for. Can you explain more about that?
Yeah, the finger trial was actually just an acronym for, it began in Finland, and I think the F actually stood for Finnish. So, and that's why it was started by a Finnish scientist named, her last name is Kivipelto. But the acronym got adopted by the Alzheimer's Association worldwide. So if you go on to Alzheimer's Society Canada, and I think there's some links to it on the Southwest Partners website as well, you'll see the fingers trial and the adoption of the fingers trial there. But if you want to look it up, you can just type in finger and dementia, and you'll get a lot of links to the original paper. But it's now become a much larger movement and a much larger study.
Perfect, thank you. So our next question surrounds hearing and the correlation of blood pressure and brain function, and how hearing aids can help.
I might take that one again as well. Just so it's actually, hearing aids were more just, it's not necessarily that they're going to benefit your blood pressure. What they do benefit though is your overall brain function, because you're able to hear and pay attention to more things. What we do find is patients, and people especially who have hearing impairment, are more likely to zone out, pay less attention to what's being said to them, and therefore their brain function starts to decline as well. So the hearing aids are a sometimes overlooked part of overall brain health that goes in line with, making sure that your vascular risk factors are also treated, making sure that things like hearing aids are placed in the right way, and that if you have a hearing impairment, you actually go out and get your hearing tested and maybe get some hearing aids, because that will always improve your brain health.
Thank you. So our next question surrounds genetics. So is this hereditary blood pressure?
You want me to? I can answer that one. Blood pressure is largely influenced by a lot of different lifestyle factors. Maybe Jasper, you can comment on the hereditary part. I believe there is a component of it being hereditary, particularly more of high blood pressure is found in families. But Jasper, maybe you could comment on that.
Yeah, we think there's definitely, it does run in families. It's difficult to separate out. We don't have exact genes, or we do have some. We don't have. Let me restate that. I couldn't tell you that if I tested a single gene in your DNA, that I would find that gene is what caused your high blood pressure. But we do know that high blood pressure can run in families. So we have a hypothesis that there might be a hereditary component to it, but we don't know the exact genes as of yet. Maybe one day we will. There's so many genes that actually form our blood vessels that it's very difficult to locate just one gene. So I think the take home is that if your family are known to have high blood pressure, that taking that multifactorial approach of making sure that you monitor your blood pressure, and that you take the lifestyle interventions is really pertinent to you.
Thank you both. So we just got another question. How does AAB fib affect blood pressure and pulse readings using a monitor at home?
I can take that one. So if you're having a regular heartbeat, if you have AFib, then what you would want to do is probably take more readings, because sometimes when the heart is not in the consistent rhythmic beat, then you're going to get some irregular beats, which also cause irregular pressures of both systolic and diastolic. So what you'd want to do is, again, be resting, as Dr. Combs had identified earlier, but also take additional measurements so that you can get more of a consistent reading as much as possible. And if you find that there are some that are really outside of what you're finding with majority of the readings you're collecting, then you could really go with the average of what you're seeing with those more consistent blood pressure readings. So the recommendation that Dr. Bangu had said of taking blood pressures a couple times in the evening, a couple times in the morning, hopefully that would also give you more consistent readings of your blood pressure. I don't know if Dr. Combs or Bangu have anything to add to that.
Thanks, Laura. So we'll take a couple more questions. So there is more literature showing the link between human microbiome and brain diseases. Any thoughts?
I don't know if Jeff or Laura want to take this one, because you guys are more researchers than I am, but it's an interesting link. The short answer to the question is yes, there's a possibility, but it's too early for us to completely tell, and it's very difficult for us to know for sure what the exact link is. So a very interesting field of study. And I'm interested to see what some of the more research, some of the new research comes out with. But yeah, definitely there is a link. I couldn't tell you the exact links.
I agree with that, but I think it probably just highlights the importance of maintaining good lifestyle factors, right? Especially in this case, nutrition and exercise will both benefit the gut microbiome, right? And that could have beneficial effects on the brain. So yeah, I agree. I don't fully understand the link between the two. It's not my area, but as with everything, lifestyle factors are probably the best way to address something like that.
Thank you. So this question is about height and if there is any correlation between any recommended effects on blood pressure.
So there is some work out there on blood pressure and height, in that when you're standing up and you're much taller, the blood vessels are longer and your heart really does have to pump against gravity to get that blood up into your brain. I don't believe there are any additional recommendations based on height, but when in research, when we're doing studies, we certainly look at height, but we also look at other measures such as body surface area, because we are looking at how that blood flow is traveling throughout the entire body. So it has to reach every part of the body. And so we look at body surface area to give us an idea of volume of the body. But for blood pressure recommendations, I think they are still the same. If you're feeling lightheaded, dizzy, any of those symptoms, then you can use some of the countermeasures that Dr. Bangu had recommended. Take longer to get up. There are compression socks. There are different treatments or items that you can use to minimize the symptoms that you are experiencing of low blood pressure.
Perfect. Thanks, Laura. And our final question for today is about spices. So how does spice in food affect blood pressure and its benefits?
I'll start off in saying spices actually may be beneficial to the brain, there is some evidence of that. What I will say is, if it's too hot and you take your blood pressure immediately afterwards, you might find your blood pressure is raised just because you've sent your body into overdrive. So maybe just wait if you've had just a very hot meal. But there is some evidence to say that turmeric and spices like that have some beneficial effects for the brain, and that might be through benefits with blood pressure. It's not very strong evidence, I would say, so that doesn't mean that you should put turmeric in everything, but there is definitely some evidence towards that.
Thank you so much. So that's all our time for questions for today. I just wanted to thank you all again for your expertise and knowledge on this topic. To our attendees, thank you so much for attending this month's Brain Matters webinar. We hope to see you next month, which leads me into our next topic on dementia and driving. So we'll hear from four people on that. So Rhonda from the Alzheimer's Society, Gary from Baycrest, Mark from Sunnybrook, and Nanette is an OT. So the date is November 24th at noon, and registration will be open soon. So last but not least, we have a short evaluation when you hit the end at the end of the webinar. It will pop up, and if you can fill that in, that would be awesome. Or you can just scan the QR code on this page to access that sheet. So thank you again for attending, and have a great rest of your day.